All right, this video is on forward head posture. So go ahead and assume the position of forward head posture. So this is going to be in combination with kyphotic posture at the thoracic spine. Usually they're pretty accompanied. You could obviously have still a little more normal thoracic posture and terrible head posture, but generally, and this is a little bit of an exaggeration, but not always when people aren't paying attention to the posture, this is the posture you're going to have. So increased kyphosis of the thoracic spine. We're going to stay here and have you turn 90 degrees to the right. So you're going to see that protracted scapula. So one of the things obviously you want to fix, and you can go ahead and correct this posture here, is retract that scapula. We got to get those scapula back here. So with those scapulas being protracted because of the kyphotic posture, so go ahead and 90 degrees to the left, that's also going to cause the shoulders to be rounded, quote unquote, which means they're also internally rotated, okay? So this kyphotic posture is then going to be followed by cervical flexion or protraction. And then at the top, and this is what people get so confused about for whatever reason, the capital extension is what is occurring here, and this is what makes your upper traps tight. Because if she were to have, so go ahead and like flatten this part of your back, how you're going to look to the ground. So if she just stays flexed or with the protracted cervical spine, she's going to be looking at the floor. So to correct that, she's going to bring her head back up, and that's how you're going to have that capital extension. So running through this posture again at the top and work our way down, we have extension at the capital. So our capital extension joint, suboccipital joint is extended. We have flexion, protraction at the cervical spine. We have internal rotation of the glenohumeral joint. We have protraction of the scapula and increased kyphosis. So then what we need to be doing is thinking about what is stretched and what is tight. So again, this is why the upper traps are tight here. Your cervical extensors are going to be elongated. So your traps are actually elongated until they get to the top. You can have a part of a muscle shorter and a part of it longer. I think that's probably where people get the most confused. So like, well, wouldn't the traps be longer altogether? Maybe, but this section is what's tight. So then in the front, you're going to have your cervical flexors or protractors are going to be tight because now you're farther forward. And then we have, if you're internally rotated, your subscapularis, for example, your pecs are going to be tight. So you're going to need to stretch those guys out. Your rhomboids and middle traps are going to be overstretched here. And also, people don't think about this very much, but your abdominals are also going to be tight because with that kyphotic posture, you're going to actually shorten that distance for your rectus abdominis, for example. So that's going to be tight, okay? And then, of course, your erector spinae at the thoracic portion are going to be overstretched. They also need to be strengthened. So go ahead and correct the posture so it looks great. So if we stretch things correctly, we cue correctly, we teach correctly, and we strengthen correctly, then we can have good posture and get rid of that forward head with increased thoracic kyphosis. All right, this video here is going to be on the increased lordosis or lordotic posture that you'll see in your PowerPoint. So this is normal. We should have a little bit of lordosis here, of course. We've talked about that a ton already. So this posture here is when really you think about those abdominals. Either you have a lot of weight, so I like to call it the fat old man syndrome, really. You just got that huge gut that's just going to pull that pelvis forward. And then you're going to have super weak abdominals. So go ahead and tilt forward into that lordotic posture so you can see the increased lordosis. So you have an anterior pelvic tilt, which means the hip flexors are going to be tight. Also, your spinal extensors in the lumbar spine are going to be tight because the back is extended. So what's going to be overstretched? Well, like I said, the abdominals are going to be overstretched, and then all of the hip extensors. Your glutes are going to be stretched and weak, and so are your hamstrings. So this is going to put a lot more pressure on the anterior longitudinal ligament in that lumbar spine. It's also going to close those facet joints. So a lot of times you'll see this in conjunction with stenosis, go figure, because they've been cramming, slamming those facet joints together for years. Now they have those osteophytes growing. So now we have stenosis mixed with the worst position for the lumbar spine to be in, and then people present with all those symptoms. So we need to be able to get out of this. So to get out of this anterior tilt, we need to posteriorly tilt. So we need to strengthen those glutes and those hamstrings. That's why a lot of times those old men got that flat butt. We need to work on that. And then we need to work on the rectus abdominis to help pull that pubis up. So go ahead and tilt back to normal. Awesome. That's what we need to do. But those hip flexors are going to be super tight, and that spine is going to be stuck in a lot of extension, and it's going to be tight as well. But with just a little bit of understanding of how that pelvis tilt is going to change what happens at the lumbar spine, very successful with getting patients to get rid of some of that stenosis pain if you can actually get out of that pelvic tilt. Also, that pelvic tilt, you can't see it here, but if you were to go ahead and tilt back into that, then a lot of times what starts to happen is more compensation in the thoracic spine. I'm not going to have her do that and just keep having a ton of terrible postures. You can relax back to your normal. But yeah, so you can think about starting here, you have that posture, then we get the kyphotic, then we have the forward head, and it's just a cascade of events that happen. So that is your increased lordosis or lordotic posture. All right, this one is going to be on the swayback posture. So it's going to have a lot of the same characteristics as the increased lordosis or lordotic posture, but with one major difference. So what's going to happen is you're going to still have lordosis, and that could increase. But instead of the pelvis itself being tilted anteriorly, the entire pelvis is shifted forward. So she's going to assume the position for this posture. Go ahead. So we still have that lordosis here, okay? But the hip is the entire pelvis is shifted forward. So instead of having flexion as the osteokinematic position at the hip, we're actually having extension at the hip. So she's resting on the Y ligaments, the iliofemoral ligaments on either side. So we should hopefully remember back from the hip, why does someone rest on those ligaments? It's because they have weak glutes and they're not using the glutes, okay? So we need to strengthen those glutes, and then that will help shift the pelvis back. So we also see that we have that lordosis, but what's that do here? It then increases that kyphoticness of the thoracic spine, and then the forward head posture and capital extension all the way up. So really I think it's important to look at the bottom and work our way up, because if we just work at, for example, the forward head, we're not going to correct these other things here. So a lot of glute strengthening to pull that pelvis back so we have the confidence to not fall forward, so we're not in that weak glute max type posturing gait thing. So we get out of that slouched, relaxed posture, and now we're back to having proper posture.